Hi, A&P1 students. This is Dr. Granier. I am doing some of our connective tissue models to help you prepare for your histology exam, lab exam that we're going to have usually around week 4. All right, so one of our other specialized connective tissues besides bone, besides cartilage, is our group of connective tissues that are going to have an extracellular matrix that is fluid. So these are fluid connective tissues. Blood is one example, and the other one is lymph fluid. Okay? Now, all of our other connective tissues, we've talked and honed in on. Fibroblast cells live in this environment and they produce a protein, and the protein is going to take up space around them, and they make that collagen protein, elastin protein, and those reticular proteins. When we look at lymphatic fluid and when we look at blood, there are no fibroblasts, so therefore we are not going to have any collagen proteins, any elastin proteins, or reticular proteins. Okay? So the extracellular matrix is a fluid background, and there is no collagen, no elastin, no reticular fibers. There are other proteins, but those proteins do not come from the fibroblasts. Those proteins might come from the liver cells, or they might be hormones or other signaling molecules taking a ride in our blood supply. Okay? Now, when we look at our blood under a microscope, this model is trying to show you that the most likely cell you will see are all of these red cells, and those are your red blood cells known as erythrocytes. All right, now the model is exaggerating, but for every 100 cells you should see 99 red blood cells and 1 non-red blood cell or other item. Okay, you don't quite see that, the numbers don't work here. But we are trying to show you that these are the white blood cells that are in circulation. The white blood cells, the red blood cells, and these little blue things are our platelets, and they all come from our red bone marrow. And for many of the white blood cells, all they're doing is hitching a ride, and they're trying to get to a permanent location, maybe in the connective tissue behind our epithelial layers that are lining our airways, our skin, lining our digestive tract. All right? They are trying to just get from the bone marrow to those locations. So they're hitching a ride. All right? A few of these cells may want to go take up residence in the spleen, in the liver. Okay? But again, for the most part, the most popular cell that you will see in your blood is your red blood cell. Okay? And for right now, the cells that have a nucleus, the cells that seem to maybe have these bumps, this white and more robust maybe cytoplasm, those are our white blood cells. And we might not see it all with our naked eye when we look under the slides, but these little blue dots and figures represent our platelets. In blood, the extracellular matrix has a special name. It is known as plasma. So this greenish, yellowish background represents your plasma. Again, there are proteins here, but there is no collagen and no elastin. And if we go back and think about what type of cell is blood always bumping into when it's running through your vessels, running through your capillaries, running through your heart chambers, remember that our endothelial cells, those simple squamous epithelial cells, are what is going to keep the blood in our chambers, in our vessels, and not allow this blood to then move into the area behind those endothelial cells, which would be our extracellular fluid. Okay? Now, some of this plasma leaks out in our capillaries, and when it leaks out, that helps provide some of our glucose and amino acids and sodium and calcium and potassium to the cells in that area or in that organ or in that area of your body. We need that fluid as it leaks out. We need some of the fluid already there to be collected and moved back towards the heart. So when this plasma leaks out, and provides some nutrients and some fluidy background material, our interstitial, our extracellular fluid in our areolar connective tissue, in our adipocyte or adipose tissue, in our dense regular connective tissue, our dense irregular connective tissue, all right? Our elastic connective tissue. That fluid, as it's leaking in, we want some of the fluid that's already there to be gathered up and moved back towards the heart so it can be put back into circulation as plasma. That fluid, when it enters tubes, when it enters pipe work to get from the extracellular interstitial space back to the heart, is now lymphatic fluid. So our lymphatic fluid is from plasma, and like plasma, it should not have any collagen, it should not have any elastin, and it's in our lymphatic vessels working its way through lymph nodes and working its way back to our heart. All right? So that's the model. It is an example of our specialized lymph blood fluid connective tissues. Again, this is mainly blood, but blood is what gives rise to lymph, and that's why we want to recognize that lymph and blood's extracellular matrix does not have, like all of our other connective tissues, fibroblasts, collagen, and elastin proteins. Okay.